In today's Health Watch, the United States is on the brink of endemic for the measles. The warning comes from health officials a quarter century after the disease was declared eradicated in the U.S. According to a report in the journal JAMA, the disease could become endemic in the U.S. if vaccination rates don't improve. Over a 25-year period, researchers project there could be almost 900,000 measles cases if rates stay the same. Right now, there are more than 800 confirmed measles cases in the U.S., including one that was just confirmed here in southern Illinois. Joining us now to talk more about this is pediatric infectious disease Dr. Marielle Frechon with Rush Hospital. Doctor, thank you for your time. We haven't had to worry about this in years. Why is it happening now? And I guess in a word, how serious is this?
Well, it's happening now across the country because not as many people are vaccinating their children and not as many people are getting the vaccine themselves. And now that we have one case in Illinois, it is a good reminder for everyone to get up to date on their vaccines.
And again, how serious is measles for people who may be downplaying this?
It's very serious. I've seen kids be very, very sick in the hospital. 1 to 2 out of every 1,000 cases die. And we've actually seen that already in the U.S. We have 3 deaths so far in 880 cases. And so that's even more than we'd expect.
So endemic, epidemic, pandemic, what's the difference?
So endemic is when a disease spreads between 2 people in the same country instead of a disease coming from outside of the country and then spreading to people who are unvaccinated. So because our vaccine rates are so low, that's why it's easier for people to get infected.
And what do you attribute that to? I'm guessing it's a lot of the anti-vax folks who worry about things that have been debunked, as I understand it, including autism.
A lot of it is misinformation. A lot of it is a lack of trust in the healthcare system. And one of the things about being a pediatrician is that you can get to know a family over a really long time and build trust. And so we're really encouraging doctors to talk to every family about vaccinating themselves, making sure that they are up to date on their vaccines, and getting vaccines for their kids on time.
So I'm curious from a personal standpoint too. My research on this shows that based on my birth year, I may need to get a booster because that stretch between I think 1960 and 70, I think was the vaccine was not quite as effective as it is now.
Yeah, that's right. The best thing to do is to talk to your doctor. But you can get a blood test that shows whether you still have immunity, and that's probably the best thing to do.
All right, Dr. Marielle Frechon with Rush Hospital. Thank you so much for the time. Appreciate it. Enjoy your weekend.